This was the start of week 3 of my 12-week program to try and deadlift 260, squat 220, bench 160, and it was a really frustrating day. And I've had another frustrating day in the gym again today. I've spoken in previous videos about this knee pain that I get sometimes, and it was causing me a bit of pain today. Just a quick side note, I compared a low bar to a high bar squat here. They're both 180. Just out of interest, because I did set myself the goal of squatting 220, and obviously low bar is supposed to be stronger, but off the back of that footage, I don't think there's too much difference to me. Obviously, if I train low bar more, it might be a little bit stronger. But I stuck with low bar squats today just to see how they felt. But I'll come back to this at the end of the video on why I'm not going to switch to low bar squats. So yeah, this knee pain that I've been dealing with, I'm pretty sure it's my gracilis tendon, and I think it's getting overloaded when I think what the problem is my left ankle has less dorsiflexion range of motion than my right. So as I go down, my left knee stops travelling forwards, whereas my right can keep on going, which makes me twist to the right a bit, and then that's overloading my right leg more compared to my left. So in the past as well, I've had bursitis in my greater trochanter on the left side, which makes sense because if I'm rotating to the left, and that is going to be getting compressed, while my right knee will be getting loaded more from coming into a valgus position. So I think that's what the issue is. So what I'm going to start doing is more ankle mobility on my left side, and trying to get that motor control so I can keep my hips square and don't turn to one side as I go down. But moving on to the main topic of what I want to talk about is different squat styles in this video. So the things that are going through my head as I'm doing this session is going low bar. If your goal is to just lift the most amount of weight as possible, low bar is going to be a better option. It's going to load up your hips more because you get more forward lean, so you're getting more of a moment on your lower back and hips, compared to a high bar where you get more knee flexion, less hip flexion, which is going to load the quads more. So this is some of the stuff I'm considering, and as I mentioned, I set that goal of trying to squat 220. But my main overarching goal is physique related. So I'm using strength training as a tool to make sure I'm getting progressive overload, make sure my training is effective, and keep my motivation high. And that's why I'm deciding not to go with low bar. I just played around with it today, and it actually didn't feel that great. But it's probably because I was getting that knee pain, and I'm just not used to squatting low bar. I've tried it a couple of times in the past before when I used to follow a lot of the starting strength stuff. Obviously, they're really big advocates of the low bar back squat for strength training, so it uses more muscle mass, all that kind of stuff. So for them, it's a more effective tool. But the other person that I've been influenced by quite a lot is a guy called Pat Davison, and he talks about minimizing movement redundancy. And what he means by that is if you think of a squat in its purest form, you can imagine your pelvis is going to drop straight down vertically, whereas a deadlift in its purest form, or a hinge, will be your pelvis moving backwards and forwards horizontally. So if you low bar squat and you look at what the pelvis does compared to a high bar squat, you get more horizontal movement as opposed to just vertical. So if you end up squatting low bar, or even if you end up squatting lots of anterior pelvic tilt, you'll see the same thing at the pelvis. It will move backwards and forwards a lot instead of up and down. So then what you're essentially doing is training the same movement pattern in your squat and your deadlift. So by picking a squat variation where your pelvis moves more vertically, it's going to remove that redundancy and train a different pattern. So that's why I've stuck to high bar. And you'll see at the end of this video I did some heel elevator squats as well, just to see if it could change my biomechanics, remove that range of motion restriction on my left ankle, and see if it clear up my knee pain, which it typically does in the past, but it didn't really work today. And I tried squatting again today and I was getting the same pain. But I think now, and you can see my gracilis tendon and palpate it, it's really inflamed. So I think I do just need to rest it for a few days before I squat again. But because it's biomechanical, I'm really bad at just leaving it. I want to go back into the gym and try and fix it and try and sort my technique out. So I'll probably leave it a few days. I'll go and deadlift tomorrow, And then another big shortcoming I have is I never ever stick to a program, and that causes me issues with my knee as well, because I end up overloading it instead of sticking to a program. So in terms of frequency, we normally look at doing something at least twice a week when we try and improve it. So I'm going to try and stick to just squatting twice a week. Recently, I've probably been squatting 3 or 4 times a week, and then as I'm currently in that strength block, form's breaking down a bit, and I'm just overloading it each time. So sticking to a program, again, this is one of the things that this YouTube channel is going to help me do, is when I write my program and stick to it, and this will be an accountability tool for me. And I'm currently in the middle of writing my next block of training, which, if anyone is interested, is going to be available on Train Heroic. So if you wanted to follow the same program as me, there'll be a link down below when that is available. So here you can see that I'm playing around with heel elevated, and I've got lifting shoes on, so there's loads of heel elevation. But you can see the difference in technique with my pelvis moving straight up and down instead of backwards and forwards. So it's more of a what Pat would call a squatty squat instead of like a hingy squat. And here I used this as my quad accessory instead of doing leg extension today, because I wanted to see if it cleared up my knee pain, which it didn't really do. It's like some sets felt really good, some didn't. I think this is only 60 kilograms, and I did a set of 20, just trying to keep tension on the quad the whole time. We know that your BMO is most active at the very top and very bottom, so just trying to get a different stimulus for it there by getting full knee flexion. And then I did do a few sets of pull-ups without a band, then moved to band assisted as well, because I felt like I could get a better range of movement and a better contraction in my back. So I'm going to stick to doing band assisted pull-ups for now as well. Going back to the squat training, it's become quite popular to squat every day. I see quite a few guys doing that now. And in my last video, you might remember I talked about different types of adaptation you can get from training. One being neural adaptation and one being structural. So when I spoke about how strong you are, that's a combination of how much muscle mass you have and how effectively you can use it in a given exercise. But as my training is primarily focused around changing structure or increasing muscle mass, the neural adaptation is not a primary focus of this training program, although how strong we get on an exercise is our motivational tool. So because it's not just about how much I can squat, I'm only training it a couple of times a week. You might have heard, like, you don't grow in the gym, you grow outside of it when you rest. So you're trying to stick to that frequency of 2 to 3 per week. Although that said, what I might experiment with in the future is, when you look at trained individuals, muscle protein synthesis, which is how your body signals to grow new muscle, that normally returns to baseline after about 24 hours in trained individuals. This is on a podcast I was listening to recently by a guy called Menno Henselmans. But the caveat to that is, if you get a lot of muscle damage, then your performance is going to be impaired the next day. And muscle damage used to be talked about as one of the things that does create a hypertrophic response, but now we know that it's unlikely to be that metabolic stress, and the main driver is mechanical tension. So if you can find a way to limit the amount of muscle damage, which is by not doing novel exercises and avoiding long muscle lengths, and again that's hard with hypertrophy training because you want those long muscle lengths for mechanical tension. But yeah, I might play around with trying to find a way to get more mechanical tension and less muscle damage and train at a high frequency at some point in the future. But yeah, for now my program is going to be a frequency of twice per week, and I'll probably throw in accessory work like leg extensions on other days, because that gets peak tension when your quads are shortened, not lengthened, so you don't get a huge amount of muscle damage from that. So if I did a load of leg extensions the day before squatting, it's not going to impair my performance on the squat too much the following day. And my last thing on my list to talk about on squats was, if any of you follow my Instagram, I've been quite vocal about, you don't need to squat. It's not necessary when you're just training for anything other than trying to squat more. And I've tried to give up squatting quite a few times in the past, and I still stand by that. You don't need to do it, but every time I try and stop squatting, I've just got like some deep-rooted belief, or like, if I feel like it gives me purpose in the gym if I have that goal of getting 220. And again, on previous videos I've spoken about having something that's going to keep you training more consistently for longer and pushing you harder is going to get you better results. For whatever reason, I've done loads of leg pressing, hack squats, all that kind of stuff, and I just don't like the goal of trying to leg press 400 or hack squat 200 or whatever. It just doesn't motivate me as much as trying to squat 220. So that's why I keep going back to it. And even though it does give me this knee pain, I just need to be a bit patient, fix my biomechanics, and then crack on with the training. So that was today's session. I ended up doing a load of these hill elevated squats to get a feel for it. Again, on this video here, actually, you can see me losing my back position a bit at the bottom. On this last set, I was trying to sit back more into it to try and offload that knee again. But anyway, and this last photo, I just did a comparison of high bar on the left versus low bar in the middle versus hill elevated, high bar on the right. So you can see what I mean by that pelvis moving straight up and down or more horizontally to show the difference in squat technique. Thanks again for watching. As always, any questions or comments you have, please feel free to leave them below and I'll get back to you, or send me a DM on Instagram if you do have any questions.